Hello everyone, I'm Dr. Farhan Tahir. I'm an integrative rheumatologist and pain management physician in Philadelphia. I've come across an interesting study that I would like to share with you. The study is pointing towards something important. It is that osteoporosis-related hip fractures rising incidence in the United States has been reported since 2013. Medicare study looked at 2 million patients, women older than 65 years of age. They analyzed the reported data of their hip fractures. The study showed that from 2002 to 2012, the incidence of hip fractures was declining. In 2013 and onwards till 2015, the incidence of hip fractures has started to rise again. The study pointed out that women who are ages of 65 to 69 have about 2.5% higher incidence of hip fractures, and women who are 70 to 74, their incidence of hip fracture is about close to 4%. Why is this happening now when we were doing so good in the past? Well, you may remember that there's been some controversy of excessive use of osteoporosis-related medications that led to actually fragility, fractures in bones, in long bones of women who were osteoporotic. That led to decline in screening for osteoporosis and also for treatment of osteoporosis. So why not should we focus on prevention of osteoporosis? Well, the prevention will start with diet. I would suggest that you should look into anti-inflammatory Mediterranean style diet. There's been enough research which has suggested that anti-inflammatory diet, which is rich in deep colored fruits, vegetables, which is high in omega-3 fatty acids, which could be from fatty fish like salmon, sardines, which could be from walnuts, almonds, avocados. They are helpful. You can also include some anti-inflammatory herbs like turmeric, ginger, garlic, and teas and spices. They all help with osteoporosis related risk factors. And also make sure that you try to fix the imbalance of omega-6 and omega-3 found in Western diets. A standard American diet or Western diet has about 15 to 17 times higher omega-6 fatty acids than omega-3 fatty acids. This imbalance of omega-3 fatty acids has led to many inflammatory diseases, chronic diseases, cancers in our population. Another important factor to remember is consumption of elemental calcium. About 800 milligrams would be the right dose for most patients. You can take either calcium carbonate if you're not on medicines that suppress your stomach acidity. It is a cheaper option, but if you are on medicines that suppress your stomach acidity, you'll have to use calcium citrate. I would also suggest trying to minimize consumption of animal proteins. When you consume excessive amount of animal proteins, your body has to offset or balance out the acidity by creating an alkaline solution environment within your stomach, and that leads to pulling excessive calcium from your bones, leading to loss of calcium from your skeleton. So avoiding or minimizing excessive animal protein is useful. I would also suggest considering 1 to 2 servings of whole soy foods if you're not advised to avoid them. Other things such as a good quality multivitamin, multiminerals would be useful for you. Make sure you take vitamin D up to 1,000 to 2,000 international units a day, and you can get that level checked by simple blood test. Most authorities on this subject suggest that a vitamin D level of 40 units is is good enough for maintenance purposes of osteoporosis prevention. Um, Another thing to remember is 30 to 45 minutes of weight bearing exercise is useful. Working with a personal trainer, personal coach, or attending some classes, yoga bar classes would be helpful. Mind and body practice, meditation to help stay focused on your goals of health and wellness would also go a long way. So please share this message with your friends and family, and please prevent osteoporosis related fractures. I wish you best of luck for your health and wellness.